using the endoscope, we can actually access lesions at the base of the skull. Earlier, these lesions used to be accessed through open skull base approach, like from above, large craniotomies, large openings. Now you are accessing the same lesions through a natural corridor through the nose with an endoscope. The advantage being that the patient can get back to normal routine and there is no incision. The most common lesion that is approached using endoscopic skull base surgery is the pituitary adenomas. The lesions that grow within the pituitary gland, which is a master gland of the body. Now, pituitary gland, the adenomas are present with multiple ways. They either can come with visual deterioration, because these lesions, when they grow, they compress on the visual apparatus, the optic apparatus, and that causes a particular type of visual loss. And the other way of presenting is because of the hormone fluctuations. It can either be hormone loss or hormone excess production, and these have separate set of symptoms. And based on those symptoms, the patient is identified, or patient is diagnosed, and on an imaging, when you see a pituitary adenoma, the best surgery possible is currently the gold standard surgery is using the endoscopic skull base surgery. Now, there are other lesions that can also be operated using the endoscopic skull base approach, like the meningioma, the skull base meningioma, the planum sphenoidale, or the olfactory groove meningioma. Olfactory groove, for example, the area that subserves the smell function. Tumors arising from those areas, like the olfactory groove meningioma, or some cancerous lesions like the esthesia neuroblastomas, those also can be approached through the endoscopic skull base work. Earlier, all this used to be addressed through a transcranial or the open skull base work. Now, most of these cases are being done through the nose. The advantage is that you are seeing the lesion, the tumor first, before you actually reach the brain. Only after you remove the tumor will you be seeing the tumor. So the brain. So the advantage is that the chance of injury to the brain is pretty low, because the chance of injuring the brain is low in such approaches. The problems of long-term issues like seizures and such matters are low. That's the biggest problem when you have an open surgery. When you have to access the lesion, you may end up inadvertently injuring the brain, and that can cause long-term sequelae. That condition is much lower in endoscopic skull base work. Now, problems with the endoscopic skull base work is, as you expect, you are going from the nose to the brain, so there is a slightly increased chance of infection happening, but those are manageable situations, and there are clear laid down protocols on how to manage these conditions. But the gold standard for most of the skull base lesions are nowadays using endoscopic skull base surgery rather than open skull base work.